Hi everyone, thanks for coming along to today's journal club. And just to start, my apologies, because if you are hearing this recorded video, then that means that I haven't made it back from Kirkcaldy, as I was doing some risk assessments over there this morning. Hopefully I will make it back before the end of journal club so that I can answer any questions that you've got. But today I'd like to start by talking about an article which has just recently been accepted for publication in the British Journal of Dermatology. It's a research letter that highlights the decline in use of phototherapy in France from 2010 until 2019. The authors of the paper have submitted this on behalf of the French Society of Photodermatology. And they publish one of these articles roughly sort of every 3 to 4 years. And I'm going to come on to talk about those earlier articles later on in this presentation. But if you want to look at any of those previous articles, you can see the first one was published in 2012 in the British Journal of Dermatology. And there was a follow-up in 2018 in the Journal of the European Academy of Dermatology and Venereology. So the rationale for this study is that targeted therapies are now commonly used in both the management of psoriasis and atopic dermatitis. And these are really the two main indications for phototherapy. So that has led to fears that these targeted therapies might have decreased the demand for phototherapy. However, the authors state that there's really little evidence in order to validate those fears. In fact, back in their first publication, the author, which was back in 2012 from the authors, they highlighted that UV phototherapy had actually increased in France from the years 2007 to 2010, and that's despite the introduction of biologics in 2004. Similar to that is the publication that this graph on the screen is taken from. It's a publication from the United States, and it provides the UV phototherapy numbers between 2000 and 2015, and you can see that there's been roughly a 5% annual growth during that period. That kind of disguises a bit of it masks a bit of variation between the different types of phototherapy. So, for example, there was actually a decrease in PUVA of about 9% annually, and an increase in UVB of 9% annually, but a much bigger increase in eczema therapies, which were sort of reimbursed by Medicare from 2003 onwards. There's been about a 29% annual increase in eczema therapies, although they still account for a proportionately smaller number of the overall UV phototherapies. UVB is by far the vast majority, and it accounts for about 77% of total volume of phototherapies reimbursed by Medicare. Between 2012 and 2015, the number of dermatology clinics that were in the USA offering phototherapy services, that also increased from 669 to 728. However, the study from the US did point out that there was a very uneven geographical distribution of phototherapy clinics, and primarily the phototherapy clinics were concentrated on the east and west coasts. So historically, the research appears to be showing an increase in phototherapy, certainly in the US over a 15-year period, and in France between 2007 and 2010. There was actually some other research earlier than this, which suggested that there was a bit of a decline in phototherapy in the 1990s, although that appears to have been reversed in the early parts of 2000. In the current publication, the authors are updating on their previous two publications, and they use the same methodology. They inquired on the French National Health Insurance Register for phototherapy, which has a unique code for reimbursement in France. A unique code for reimbursement, and that code includes both UVB and PUVA therapies as well. You have to register the phototherapy on this health insurance register in order to be reimbursed. So it's a pretty comprehensive view of phototherapy in France. And just out of interest, a single phototherapy treatment is reimbursed at a rate of 19.2 euros. The authors present their data in the form of a table, which I've taken the liberty of presenting in a graph here. So if we start by just looking at that original 2007 to 2010 data, we see that there's the increase in UV phototherapies, as was previously mentioned. However, when you look at adding in all the data from the paper, it shows that there's been a decline in phototherapy in France since 2010. I'm not entirely sure why the 2011 and 2012 data is missing. I couldn't find reference to that in the paper. So it might have been that 2011 and 12 were even higher than 2010. We just don't know. But the number of phototherapy treatments in 2019 was actually 42% lower than at the peak in 2010. And a similar decline was also seen in the number of patients, whilst the number of UV treatments per patient remains stable at an average of 17 treatments per patient. So it's not that there were less treatments happening per patient, or that there were more treatments happening and less patients. So the number of treatments per patient was stable. There was also over that time period a reduction in the number of doctors that were actually prescribing phototherapy. So that went down from 34% of all dermatologists in 2013 to just 26% in 2019. But actually the number of dermatologists in France remained stable over that period, so it's not that there's less dermatologists, just that there's less prescribing phototherapy. The authors, they point to the advantage of targeted therapies for both the patient and the prescriber as a potential reason for the decline that's seen in their data. They say that there was a 1,100% increase in adalimumab between 2008 and 2016, and an 800% increase in ustekinumab. So large increases in these targeted therapies over a period when phototherapy is declining. Now, they don't claim that there's a cause-effect relationship, just that there's that association. But they do say that they probably expect there to be further decline in phototherapy with introduction of new targeted treatments in the coming years for other phototherapy indications. And they're also concerned about the decline in phototherapy prescribers, which they are hypothesizing is a result of a move towards aesthetic and cosmetic treatments in dermatology in France. Now, as you're all aware, we have a fairly strong phototherapy provision here in Scotland, and a good database of previous treatments. So I wanted then to compare our numbers to those of France. And you can see these results in the graph here. What I've done is I've actually normalized both sets of data to their maximum number. So For France, the maximum number of UV treatments was in 2010, so that appears as 1 on the graph. And in Scotland, the maximum number of courses of UV therapy was in 2016. That's why that appears as 1 there. So you can see actually that the Scottish data is steadily on the increase from 2008 right up to 2016 when it peaked. And then there was a bit of a downward trend from 2017 to 2019, although it's not clear as if this was going to be a downward trend which would continue, or if it was more of a levelling off of data. And the reason we can't tell whether or not this was going to be a continuing trend is that because, of course, the global pandemic hit in 2020, which, as you can see from the data on the graph, absolutely decimated the delivery of phototherapy. The numbers in 2020 were 47% lower than the numbers back in 2010. Although actually that graph kind of masks the huge impact that COVID did have, because the first 3 months of 2020, it was pretty much business as usual before we went into the lockdown. If you analyse the data by financial year, so from April 2020 to March 2021, then that was actually 81% lower than the 2010-2011 financial year data. So really a massive drop. Phototherapy was operating around about 20% of its previous capacity. Just to conclude then on this short journal club today, it is worrying to see the decline occurring in France. Strong phototherapy provision globally helps preserve the treatment as a whole, because we need a strong market so that industry continues to be involved and so that they continue to provide and develop products. However, it was interesting to see that decline in France isn't necessarily globally applicable, because the data from Scotland shows, actually we were on the increase up until 2016, although there was possibly some sort of plateauing effect, or maybe even a slight decrease happening after that. We don't know why there was the strong performance in Scotland in terms of the increase and increase of numbers. We would, within Photonet, we would obviously like to think that Photonet plays a role in that, because we do promote phototherapy, provide education on phototherapy, and provide that audit service as well. But it might also just be that the commercial incentives and the reimbursement driving the phototherapy numbers in France doesn't actually apply to us here in the National Health Service. It would be more interesting possibly to compare phototherapy provision in Scotland with that of England, where the health services are more similar. But whatever the reason for that steady increase up to 2016, it's clear that COVID has had a really major impact on the phototherapy numbers. And the result of that, the long-term result of that, we don't yet know. Many patients may have been moved to biological treatments, and it's not entirely clear how phototherapy will recover, because there's now social distancing and infection control procedures, which mean that the phototherapy units can see less patients in a day, and basically the capacity in Scotland has decreased. We can maybe try to find ways around that, changes to our work practice, opening, having extended opening hours, maybe opening at the weekends. And I think home phototherapy is a plays a big part in that as well. And we were recently successful with the purchase of a number of new home phototherapy units, which is just about doubled our home phototherapy capacity, which is excellent. Phototherapy will continue to do all it can to support services to return to their previous provision. And we just hope that, what is a really important, a cost-effective service continues on, and that patients continue to benefit from its provision. Okay, thank you very much for your time today. Hopefully I've returned from my trips and I'm able to answer any questions you might have.